ladies and gentlemen. I'm Filippo Monteleone, founder and CEO of CAREIT, an investment asset and property management firm that provides capital and services to European healthcare investors and providers. I'm happy to host today our first session at MIPIM Connect, dedicated to healthcare. This session will debate the present situation of healthcare and nursing homes activity around the world and what we will expect to see in the future over the coming years. So I have here with me to debate about this, Dr. Martin Heinrichs, Director at UBS in charge of healthcare globally, and Patrick Bieschler, Senior Partner and Global Head of Pharma and Healthcare at Roland Berger, and also Head of Spain at Roland Berger. Thank you very much to be here with me today. The first question that I have for you, Martin, is when we talk about healthcare services, we have a lot of subsectors, acute care, nursing homes. What have been for you the most affected ones by the COVID-19 crisis, and which healthcare sectors have been the main winners and losers, of course?
Yeah, thank you, Filippo. I think when you're talking about the winners and losers of this crisis, you need to distinguish two aspects. There's on the one hand, the operational aspect, on which Patrick can certainly comment more competently than I can. And there is the capital markets aspect. How have capital markets reacted to this? Which sectors have capital markets seen as winners and losers? And I think there is a very clear segregation between those who, in the eyes of the investors, have done better than others. I would mention in the first place that the acute care operators have probably been net losers of this crisis, with share prices on average down 25%. Vet care and clinics even more affected, minus 30%. And you've got somewhere in between long-term care at somewhere between 27 and 28% in share price levels down. There have also been clear winners, and interestingly enough, we don't really have representatives in the public markets, at least for the winners. Telemedicine has gone through the roof. If you're looking at one of the telehealth companies listed in the US, Teladoc, they have gone up 60% since the beginning of the crisis. Very clearly, distribution and e-pharmacies have gone up. They are clear winners of the crisis. Life science tools and diagnostics in general, outside of services, have been very strong winners. And generally, actually, it's also worth noting for anybody who's invested in healthcare, the healthcare sector is the only industry, the only one since the outbreak of the crisis, which is now trading at higher levels than the levels pre-crisis, which I think is quite remarkable. If you're looking at the operational aspects, there's different surveys and data, and I think Patrick can comment on this more competently. Some people saying that nursing homes have gone down up to 10%, the volumes in clinical labs up to 50% down, elective certainly being the one most affected, with some surveys saying elective volumes down 85%. Now, we haven't seen that yet in capital market sentiment and in multiples or share prices, simply because we have very, very few elective companies listed in Europe. So we don't really have a mark-to-market of what current capital market investors think about these businesses and how they would value them in the current environment.
Patrick, I think that it will be interesting to have also your vision. You advise most of the providers in Europe in acute care and nursing homes in their strategy to face COVID and also in their organization. What about this operational impact Martin is talking about? What do you think about that?
Well, I think in terms of impact or in terms of winners and losers, complementing what Martin has said, overall, I would say for healthcare, the recovery time is assessed to be at best about 1 year. 1 year before we go back to the normal levels of activity. So if you take surveys that have been conducted in hospitals across Europe, in most of the times they have lost for the last 3 months up to 70% of their activity. So 70%, 70, of elective surgery, 40% for cancer surgery and diagnostic in general, So they've been badly hit because obviously everything was reallocated to COVID treatment, and obviously elective surgery was simply pushed to a later stage. So I think the big worry for most players is to have a crisis into the crisis, meaning that all these patients that have not been properly treated in the last 3 months will either pop up suddenly in the hospitals, or they won't be treated anyway, and that will create another type of I would say disease wave or even death wave. So I think the impact for hospitals and basically healthcare providers has been quite tremendous. For nursing homes, basically, and being very direct, the residents that died during the COVID crisis have not been replaced by new residents. But I think it will only delay by a couple of weeks the ability of nursing homes to basically have new residents coming in. And we know that by definition, residents in a nursing homes have an average age of 85 plus. So they were meant in a way to spend their very last weeks or months into the nursing homes. So for them, I believe the impact will be more punctual, if you will, and that the occupancy rate that has gone down by 3-4 points in the last few weeks will probably go up again, because there are so many residents waiting to be I would say integrated or to be accepted in a nursing home, that the consequences will be probably of less impact.
But
your other question, sorry, Filippo, please.
No, the question was also for this big shortfall in turnover in other industry will probably make some of these people shut down and close their business. But we know, and we have heard about a lot of safety package from the government. I know that you are involved in some of these discussions in France, in Germany, in Italy. What do you think about this? I mean, especially in acute care, we see that there is a package that will replace the activity that has not been produced by this provider in terms of elective surgery, for example.
So I think, well, I had two comments on this very specific question, taking into account that most of the healthcare providers, and particularly in acute care, are assuming that they will quickly go back to 80% of their normal activity. The remaining 20% will take up to 1 year to, I would say, to happen. But I think for most of them, there was like a V curve, in the sense that the activity went down and is going up very rapidly, not necessarily at the level of before, but it's going up very rapidly. So the safety nets that have been placed in most markets, in most countries, particularly in France, with the NHS already paying 1 year activity based on the 2019 figures, is probably protecting most hospitals. And also considering that more than 2/3 of hospitals in France are public hospitals, in any way they will be supported, because what may happen is to create more deficit. I think the way they are being supported is anyway very protective. So I think on that aspect, the safety nets placed by the NHS in most countries will enable most of the hospitals, most of the acute care providers to really sustain their activity and to go through the crisis. But I think, and that was my other point, the COVID has been more of a catalyst than really the cause of the difficulties in the healthcare sector. What I mean by catalyst is that it forces us to reshape the sector, which has been poorly invested in the last few years, which has been poorly, I would say, reformed in the last few years. And all of a sudden, public interest and governmental interest has been placed on the sector. So we hope it will be for the good of the sector, obviously, but typically when we talk of reshaping the healthcare systems across Europe, I think overall there will be more prevention, and we can see that with the COVID testing and all the testing in general of fragile populations, because it avoids emergency hospitalization and, I would say, extra cost of healthcare. So I think all the digital players that Martin mentioned will be helping, typically in an increased prevention. There will be, I believe, more diversity in the type of care that you may receive, from teleconsultation down to the hospital, I would say the hospital stay, because in most diseases and in most conditions, including the elderly, you are not necessarily doomed to be either at home or in a hospital or in an institution. There will be lots of shades of gray popping up, which include some short stay centers, including also short stay centers for the elderly. Some, I would say, some home and institution stays, also for fragile people, including old people. So diversity of setup, diversity of offering will probably happen much quicker. And last but not least, there will be an increase necessarily in capacity. We have seen that in France, where they moved from 5,000 up to 14,000 beds in acute care and in intensive care units. And I think more generally speaking, we know that in some markets, and that includes France, that includes Spain, that includes several markets in Europe or in OECD in general, there is an undercapacity phenomenon. And the way to catch up on this undercapacity phenomenon will be to create new centers or new beds, but also to ensure versatility of the beds that are being created. What I mean by versatility is exactly what happened in Germany. The same bed can be used for surgery or for intensive care. The only difference at the end of the day is the amount of equipment that you have for a given bed. And then the staff will be adjusted accordingly with the need you have for that bed. So again, four main consequences: prevention, diversity, capacity, and versatility.
Okay, and Martin, I think that this is very interesting. Also thinking about what's going to happen in the future. But before talking about this and your vision about this future of healthcare services, I think that would be interesting also, Martin, to see how do you see the differences among different countries and different geographies. We have seen the performance of the system measured by numbers of deaths, and we see that, for example, Germany has been better than France or Italy or even Spain, of course. But what about the providers there, for example, of acute care that are reimbursed by public pay or versus private pay? What do you think, Martin, about that?
Yeah, as you rightly say, I think there has been a significant difference in terms of fatalities across countries, but also a significant difference in performance depending on the reimbursement mix, statutory, private medical insurance, and then of course out of pocket, which has probably been the one, in particular for elective surgery, which has suffered the most, because people have in orthopedics or in dentistry or in cataracts deferred surgeries. And whenever there was an out-of-pocket element to those reimbursement rates, that has, of course, had a very negative impact. As you rightly said, there has been very different degrees of preparations and action with regards to coping with the crisis. To give you one example, if you're thinking about the total, and Patrick was talking about intensive care beds, you're talking about the total intensive care bed capabilities and capacity that the German acute care sector has. It's a bit more than 5,500, which is more than the whole of the UK had at the beginning of the crisis, just to put things into perspective. And if you're looking at testing capabilities in Germany, for example, fivefold of the NHS in terms of intensive care beds at the beginning of the crisis, almost sevenfold what the UK had, which is an explanation for why we have seen very different behaviors across different countries. And we'll probably continue to see that as this crisis pans out.
Let's talk now about how this we will face the crisis in the future in terms of providing capital for this these activities. We know that most of the providers of acute care or nursing homes in Europe are listed on the stock exchange or owned by private equity or some institutional investors. What do you think about this, Martin? What about the M&A activity first, and then what about the option in terms of capital market and debt market for these people that are for sure need more capital in the future to develop their activity and to face the second phase of this and the future of healthcare services for them.
So I think there's two questions. Let's maybe start with the M&A question. You're absolutely right. If you're looking at the M&A volumes overall in healthcare globally, they have very dramatically collapsed year to date. So just to put things into perspective, globally in healthcare, we are at 10%, despite being already in May, we're at 10% of the global M&A volumes that we had in 2019. Now, admittedly, 2019 was a record year, and we're currently at around a third of the overall M&A volumes compared to 2008, which is maybe a better comparison because it was a crisis year. If you're now specifically looking at healthcare services, over the last 10 years, it's fair to say the healthcare services M&A volumes of all healthcare volumes have been somewhere between 25 and 35%, roughly and very consistently. This year, in the first 5 months of this year, healthcare services M&A volumes as percentage of total healthcare volumes have only been 15%. So in an environment where M&A volumes are already depressed, healthcare services M&A volumes have been even more depressed. And the question is indeed also then, the next one is, so in such an environment, how do I get my deals financed? Is there any debt financing available in the market? And the good news is there is. It is often a slightly different debt financing than what we have seen before. Taking an example here in Europe and one in the US, there has been a disinfectant company which has been acquired by a private equity called Schülke, whose trading has, of course, gone through the roof throughout the crisis. They have been able to get debt financed by the private equity acquirer, but it was done through a direct lender rather than a bank underwriting it. And if you believe rumors in the press, at a leverage of 4.75 and 600 basis points financing pricing, which is much higher than the levels you would have seen pre-crisis and leverage lower than the levels that you would also have seen pre-crisis. We, interestingly, as UBS, did a deal just a couple of weeks ago on a very large outpatient behavioral health business in the US, which has about 1 million patient visits a year. And that was also financed through a direct lender in a unitranche transaction. So it wasn't the banks providing the financing, but the direct lenders. And that might be one of the ways going forward, or at least one of the financing means in an environment where banks are often more reluctant to underwrite financings. I think the other consequence that we will probably see is that there will be an impact on much larger transactions. So you can get direct lending financing for transactions up to a certain size, but I wouldn't see that for 5 to 6 billion transactions happening. But I think it's at least good news that in this environment, we will continue to see financing for a sector which, as I said at the beginning, has been, at least in the equity capital markets, by a margin, the best performing sector across all industries.
And what do you think this will change in terms of real estate investors position themselves? We know that there's been a lot of activity that has been sell and lease back of assets by private equities. What do you think, Martin? Is this an opportunity for real estate investor to back some of this transaction, or to finance or to be there where the banks are not today?
Well, there's two aspects. First of all, if you're looking at the equity capital markets, the good news for investors looking for opportunities, and again, you should see the equity capital markets as a mark-to-market proxy for what is also going on in the private markets. So in the public markets, the acute care trading valuations have gone down, albeit not as much as people might think. So on average, if you're looking at the listed EMEA players, they are now trading at around 9 times 2020 EBITDA compared to 9.5 times pre-crisis. And in long-term care, the current trading valuations are roughly around 9.5 times compared to 10 times previously. Why hasn't that gone down further? Well, it has to do with the fact that the analysts have also adjusted their earnings estimate in line with the share prices, which means that mathematically the valuation multiples have gone down. If you're looking at the cap rates of the listed REITs, they have generally gone up throughout this crisis, which is not entirely surprising. So I think there will definitely be opportunities to acquire. One needs to bear in mind, though, that, and that's something that will also be interesting to hear Patrick's perspective on, and he has already talked about it, is we will certainly see an impact of this overall crisis on the future shape of some of those businesses. I think there will be a move towards digital health. We have seen a move from moving patients out from acute care settings into lower acuity settings, which certainly some of the payers will want to preserve post the crisis because it's a cheaper alternative. So we will see personal expenses going up, sanitization costs will go up. So before considering any transactions, one also needs to look at what will be the impact. Will we see more outside of residential care, provision of care, both in acute care and in long-term care, question mark, which will have an impact on investment decisions in this sector.
And of course, these are marginal impacts for the sector that has to be taken into account. Now, it's true that compared to other sectors of the economy, we are still on the safe side, or seems to be in the safe side of the situation compared to others. But Patrick, about the future of healthcare, you told about some ideas that will reshape the way we will treat patients or manage elderly care. But what is for you? What is also the impact more on how does this let's say shape or change the way providers position themselves in this respect, and maybe speak about a little bit more nursing homes, because we had discussed a little bit more about also acute care during this session today.
Yeah, I think as a preliminary remark, we have a tendency to see all the negative impact from the crisis, but in terms of healthcare, I think there are many positive impacts that are worth mentioning. First of all, and that reflects, I think, in the valuation impact that Martin was talking about, this sector has proved to be resilient. I mean, I think everybody has been very thankful for healthcare providers to be in the field, to deal with patients. We all applaud at night nurses and all the caregivers in general. So I think this sector is not only resilient from a consumption of care perspective, but it's also becoming very attractive in terms of jobs. And I think one element that, for instance, nursing homes were suffering of was the lack of qualified staff. And I think this crisis, in a way, can reveal new, I would say, new segments of jobs that people that have been maybe patients in the past will now go to as professionals. So I think there is at least a very good aspect from resilience and attractiveness of the sector for the staff. And there are some subsectors that are going to grow very, very dramatically. E-health obviously will be one of them, but we could also mention all the prevention players, starting with labs, biological labs, and also some companies dedicated to really monitoring healthcare in continuity. Mental health is also an area that we have not talked about, but mental health will be probably positively impacted by the COVID situation, both because there will be some, I would say, post-trauma disorders to be taken care of, both for people that have been locked down in their homes, but also for the caregivers that have really been exposed to a lot of stress in the last few weeks. So I think, again, we can also outline some positive, if I may say, positive aspects of the crisis. And finally, it also enhanced the agility of the caregivers. And we all know fight against the lack of masks, of sanitizers, of equipment in general. And this has increased not only cooperation, but also innovation. You remember those masks, you know, from Decathlon that were used for as ventilators. So I think in general terms, it has triggered some agility for the sector, and that agility shall remain. Obviously, the other consequences in terms of how the centers are being set up will be key. I was mentioning earlier that nursing homes, for instance, have a huge diversity of setups between, for instance, France and Spain. In Spain, you have more than 70%, so more than 2/3 of the centers have double bed rooms. So you don't have single bed rooms, which have become kind of the standard to avoid, I would say, contamination of patients or contamination of residents between themselves. So I think in general terms, there will be lots of, I would say, reshuffling of centers to avoid any type of contamination, to enhance the security levels. I think, Martin, you mentioned that there will be a higher cost because there will be more, I would say, strict standards, quality standards, but this requires also some new installations or maybe a rethinking of how the centers are being organized.
Yeah, because we have a, this is a good point. We have at MIPIM, we have not only investors but also architects, developers, building companies. So there is also one big question about the future of these buildings. If there are new layout and new opportunities, and also a big wave of modernization and rebuilding of facilities in Europe. I think that you gave some examples that are very interesting, and I think probably also in the acute care, the flows of patients will need to be more cautious and maybe more flexibility, as you said, in ICU. But this will provide also will need also more capital for sure. Even this will be different. Martin, what do you think that there's gonna be you know, a movement where all this need of capital for this capex, this modernization, or this evolution of these markets will attract investors that were more reluctant to invest into this sector, or because it was a little bit different from what we were investing? Do you see any movement from institutional investors more than private equity, or for other kind of investors in the market coming?
So first of all, this continues to be, as Patrick said, a very attractive sector because the fundamentals of the sector remain intact. And specifically, if you're talking about nursing homes, but the same dynamic applied to acute care, the population is going to become dramatically older in the next 10 years, and that will naturally feed these kind of services. In terms of investors, I think this will continue to be an attractive sector, both on the OpCo but also on the PropCo side. And we've actually seen that it has attracted, in the last 24 months, a new breed of investors beyond traditional private equity, then of course REITs, with the emergence of infrastructure funds now being very active in virtually all of the healthcare services auctions that we see. We have seen some infrastructure funds being very active investors in the space. I'm thinking of Antin, I'm also thinking about EQT Infrastructure, just to mention a few. And then, of course, also family office money, which has flown into the sector, attracted by both the fundamentals, but also the underlying real estate banking, which, in particular for family offices, it's something that is attractive. So I'm not concerned around future sources of capital for expansion or for adaptation to new business models.
Okay, thank you very much. I think that we have a good session about the situation, the impact. I think that everybody has understood that we have suffered. Everybody has suffered also in the healthcare sector, but I think that you probably mentioned what is most important is that this shortfall has been a little bit covered by safety net from the governments, but also I will say that the futures seem to be bright for this sector, but with a lot of changing and evolution that need to take place now. And as Patrick said, it's probably just something that should have been taken into account some years ago. And so this is a catalyst also for new evolutions, but also new opportunities. Thank you very much, Martin. Thank you very much, Patrick, to be with us today.
Thank you.
Thank you.